It was probably about this time on Monday that your phone made a really annoying and, for some, startling noise, and that's the alert that you've got an emergency alert coming from the state. In this case, it was from the governor to tell you that you need to wear a mask, something that I think most of us already knew. That has caused there were some people that felt unnecessarily alarmed. And that have drawn to the conclusion that that's not what the state's emergency alert system is really for. One of them is at the other end of our line. He's also got an update on his nursing home bill. Senator Pete Lucido, good afternoon, sir.
Good afternoon to listeners across the state.
So you felt that the EAS system was used inappropriately on Monday? Tell me why.
Well, yeah, it's pretty obvious that the legislature had created an emergency alert system and also a Amber Alert system. The Amber Alert system, everyone, is clear. That deals with a child abduction. We just had that this last Monday also after the governor's emergency alert. The emergency alert system, though, was for when there's a riot, insurrection, civil commotion, that's where a war, there's a tornado, there's going to be a flooding. It was never intended to go ahead and say something that the governor already told us on Friday with her executive order that we are going to start wearing masks in every facility, meaning shopkeepers in the state. Now, that being said, there was some unclarity of what a mask is, number one, and more importantly, how do you handle disabilities. But go to the alert system. The alert system was never intended for this. In fact, the legislature put it in place for states when we're under attack, that the war starts, that the riots are starting, to take cover. Tornadoes are coming. There's going to be a flood. I knew on Friday when she had her press conference. I knew on Saturday when it was put in the paper. I knew on Sunday when the social media put it out. I knew that on the radio, like you have said, Guy. And at the end of the day, I even knew Monday morning. What was the intended purpose of alerting us and shutting down phone lines during that period of time when we already had ample notice? In fact, my mom, 91, reads a newspaper and watches TV and knew about the mask recovery and restriction and never had to hear it from a phone because she doesn't own a cell phone.
I'm in total agreement with you on this because I thought it was wackadoodle. But let me play devil's advocate just for the sake of it, and that is that not everybody plugs into the media like your mom, my mom, and others around us. And forgive the yard crew here behind me. What about you're trying to reach everybody, even those that may be totally unplugged? Is that a legitimate excuse or a legitimate explanation?
No, because the legislature, they had legislative intent when the emergency alert, not the Amber, like we talked about child abductions, but emergency alert was intended for those things that I indicated, which means when lawyers and lawmakers look at law, they look at the legislative intent of what was in the mind of the legislator and the people that voted it in. Guy, here's another thing that's important.
Well, I want to save time for the nursing home thing too, so let's not get too deep into the weeds. But very quickly, how would you define disaster? And do we get too deep in the weeds when we try to do that? Do we really need to do this through legislation?
I'm not asking other than this. Please don't. You've already used the emergency alert system 5 times, Governor. Can you be a little bit more specific on why you think you need it? Because I want that policy discussion before people start ignoring an emergency alert and not taking it serious anymore.
I think that's a legitimate question. Have the discussion and at least have some kind of better framework for this. Now, you had some major testimony today. Tell me what happened with your bill. I think you've got approval. What will it do, and what can we look forward to in terms of keeping our seniors safer?
Yeah, I'm really excited because I want a solution, and I know not one's coming right away. I know the governor put together a task force. That task force might take a long time to come up with perfect policy, but until then, no more COVID will go into a facility with non-COVID, which means our elderly, our most vulnerable, our most compromised immune systems should not be placed in a real compromising position to have sick people come in there. So, COVID folks will have to now, after this bill passes, go to just a COVID facility, earmarked for COVID facility, kind of like TCF was supposed to be, kind of like the Novi Expo was. But we are going to take a nursing facility where we have proper medical help and personnel, where you have proper PPE that's on staff. And the state of Michigan is going to inspect it first to make sure that it meets the criteria under LARA, the licensing rules, as well as Health and Human Services, before anybody is taken to the hospital. And it's only during a period of 14 days to make sure that they're negative before they go back home to the nursing facility, or that they're discharged to the nursing facility.
But you also allow for them to return to their nursing home if their nursing home can prove, and I guess that's the key thing, how do you do that? Prove that they are truly isolated from the rest of the population.
So the MDDH, the Michigan Department of Health and Human Services, is charged with ensuring that people's health and safety is first and foremost. That's what their duty is. That's what their responsibility is. LARA has the same responsibility for licensing nursing homes. If they can prove that it has a separate door, separate staff, if they can prove that the HVAC is separated, then they can go back to their home, so long as all those things are met. And separate staff means that there's not going to be any cross-contamination, that they're going to be walking from one side of the nursing home into the other side of the nursing home to take care of those patients. If they don't have that guy, then they don't have the right to return to that facility.
All right, and Pete, before I let you go, the likelihood that the governor will sign this once it's passed by your colleagues in the House.
You know what, Governor, it may not be perfect, but we're going to have you champion the Lucido bill for this reason. We want to save everybody we can, day in and day out, like you told us, the science and data. Let's make sure we have good reporting first, because we still haven't gotten those death rates in the nursing facility. And then I want to see you pen it to paper, because then you're going to be my champion, because it's going to work this time. Because every other state did it. And just to finish up, Rhode Island's governor said we did have some COVID folks discharged from hospitals to nursing homes, and of course, we don't do that anymore. Now we cohort all COVID patients in the same nursing home.
Right.
Where all these nursing homes are putting them into one facility. We should do the same, because it's working.
We need some kind of consensus on this, Senator. We thank you for taking the lead on it and for holding these hearings, and we sure appreciate it.
Thank you, Guy, and thanks to the listeners, and enjoy the sunshine, because we got blue skies still here in Michigan.
Amen to that.